So here we are going to discuss about the different positioning and what are the clinical significance with the different position and what NCLEX question asks regarding or about the different position. Like the first picture here, this is called supine, right? Supine position. This patient is lie down on the bed on their backside, right? So NCLEX board asks when patient need in supine position, when need. So if the patient has a neck injuries, right? Or if your patient need the log ruling for movement, that times we need supine position, right? NCLEX another question asks that if the patient long time in this positioning, the chance of skin breakdown, right? So let me recap it. It is the position is called supine. Patient is lie down on bed on their back, and NCLEX asks a question: what are the medical condition patient need to supine position? I said if patient has a neck injuries or if need the log rule for movement, right? And if your patient keep the supine position for a long time, the chance of skin breakdown. So as a LPN or RN, we have to check their skin. We should change the posture to prevent the skin breakdown, right? The second picture is here. This is called prone position, right? The prone position patient is lie down on bed on their stomach or abdomen, right? What medical condition patient follow the prone position? If your patient has any kind of spina bifida means the problem is there, spina bifida, right? In that scenario, patient need prone position, okay? Secondly, if your patient have any kind of surgical insertion in the abdomen or abdominal incision, this position is not suitable, right? Or if patient has any kind of abdominal surgery, this position never for them. Also keep in mind, this position not for the patient if your patient have any kind of respiratory distress or respiratory problem, right? Very important. The picture number 3 showing the right lateral recumbent position, right? If the patient lie on the left side, we call left recumbent positioning. So again, I said, if patient have any kind of medical problem in the left side, we can tell them to right lateral recumbent. If patient have a left medical problem, we tell them to lie down in the left lateral recumbent position. So what next here? Next here, this is the picture, left lateral recumbent posturing, right? It is not the lateral posture, not a sim posture. It is the right or left lateral recumbent positioning. And this position, the Fowler, before to go Fowler posture, I want to tell you Tendelpark posture first. The Tendelpark posture, the head is down, you see, but the foot is up or toes are up. This is the medical posture we need if your patient have a hypovolemic shock. Hypovolemic shock occur if patient have a hypo blood pressure or hypovolemia, right? So hypovolemia or hypotension lead to the hypovolemic shock. In that medical condition, we tell them the patient to Tendelpark posture. Another medical condition also we tell them for this posture is called cord compression during the delivery. Cord compression during delivery, right? So now go for Fowler posture. This is the Fowler. So the Fowler posture actually low Fowler, semi-Fowler or semi-Fowler, and high Fowler. That it is depends upon the degrees or angle. So when patient is keep in a Fowler posture, the relax the abdominal content. This area, abdominal content will be relaxed and very easy for breathing. So if your patient have any kind of respiratory problem, we tell our patient to Fowler posture, or it is prevent any kind of aspiration, right? Any patient like autonomic dyslexia, always we prefer the Fowler position. So second, the Fowler position, I said that three angle. One is called low Fowler positioning, right? So low Fowler position is less than 30 degree. Semi-Fowler, like this picture, the 40 to 60, the angle, this is the bed and this is the patient angle. The angle make here 45 to 60, and this is a semi-Fowler position. This picture, the angle is less than 30 degree. This is a low Fowler positioning, right? And the picture number 3 here showing this angle is more than 80 degree or more than 60 degree is called high Fowler posture. You see, 0 to 30, 30 to 40, 40 to 90. So it is depends upon. In secondly, here showing according to this picture, low Fowler posture 0 to 30, semi-Fowler posture it is 30 to 40, and some book wrote it is 40 to 60 is semi-Fowler. So Fowler posture 45 to 60 and high Fowler is 60 to 90. In some books say high Fowler is above 60, right? So this one, so I said the Fowler posture we need if patient need the relaxed abdominal content and easy to breathing, prevent to aspiration, or if the patient has a autonomic dyslexia, always we prefer this posture. And next here in this picture we are going, and This is the supine we already done. Sometime NCLEX board asks a question, who would need to be on a turning schedule? Who need to be on turning schedule? The supine posture, right? This posture is called Sims posture, right? Is called Sim posture. Sometimes it is called lateral sim posture. So here you can see the one leg is a flex, right? Another leg is extended, is a sim posture. So sometimes patient keep this posture in case maternal fetal distress, or after C-section, or if patient need to put enema, rectal enema, or if patient need to put the rectal suppositories, we always prefer the same posture. Even after liver biopsy, the patient supposed to be right lateral positioning, which is look like right lateral posture or Sims posture. Another posture is here. This one is called dorsal posture, right? Is called dorsal recumbent. Dorsal recumbent posture, the two knee is flexed. This posture basically follow for vaginal examination or perineum area examination. If patient lie for a long time in dorsal recumbent posture, the patient has a risk for blood clot formation. Keep in mind, blood clot, not the skin breakdown. Skin breakdown occur if patient is supine posture, supine. But here it is blood clot formation. The dorsal recumbent posture is best position for vaginal examination and rectal examination, right? Another posture is here. This one is called lithotomy posture. Lithotomy. So lithotomy posture always also very good for vaginal delivery, or lithotomy posture is good for pelvic examination. If the patient keep lithotomy for a long time, the chance to develop blood clot like dorsal recumbent posture, but the supine posture chance to develop the skin breakdown, and supine position need to be turning schedule. Another posture, this is the sitting posture, right? Another posture is here is called the knee chest position. Knee chest. Knee chest position is good if the maternal distress or fetal distress. If baby need oxygen more, right? It is the good posture, is called the knee chest posture. So I could tell you this is the important for NCLEX board exam, and sometime NCLEX board asks a question from here.